My name is Greg Zahn. I'm an assistant professor of clinical emergency medicine. We're going to cover an intro to cardiac echo. Specifically, to obtain ultrasound images, we utilize the phase array probe. This is the probe that is often used for cardiac and fast examinations. It's utilized because it has a footprint that tends to fit a little better in between the intercostal spaces. And additionally, it's an appropriate low-frequency probe that is often needed for the depth that we require for cardiac imaging. Probe orientation is important because every probe has directionality to it. This directionality helps orient the user as well as the viewer of images, and there's a standard in which this is performed. For cardiac ultrasound and for anything point of care, we often talk about directing the probe orientation marker towards the patient's right, which we'll get into in subsequent slides. There are 4 basic cardiac views and then an additional IVC view. These 4 basic views are a parasternal long axis, a parasternal short axis, an apical 4, a subxiphoid, also known as a subcostal, and then the IVC view. This slide represents a paper that does a great job of an intuitive approach to point of care ultrasound, and it talks about the 5 E's. When we look at point of care ultrasound, we're trying to answer a clinical question. This is not a formal echo, and these 5 E's being effusion, ejection, equality, exit, entrance can really help us determine specific concerns as it relates to patient presentations. To talk about the 5 E's, the first E is effusion. Ultrasound is a great diagnostic accuracy for pericardial effusions, and it has been utilized in fast examinations and trauma for over 20 years. And in this view, what we're looking at is we're looking at the heart. This is a parasternal long axis view, which we'll get into more. There is fluid in the pericardial sac that surrounds the heart. And so for a little bit of anatomy, this is the left atria leading into the left ventricle, aortic outflow tract, right ventricle, descending thoracic aorta, and fluid around the heart. Next, E stands for ejection, and specifically looking at the ejection fraction of the heart, we have what appears to be a normal cardiac ejection fraction in the top view and a reduced ejection fraction in the bottom view. When we talk about ejection fraction, we are viewing the heart as a muscle, and like every muscle, when it contracts, it should thicken. The walls should come towards each other. We also are looking at the anterior leaflet of the mitral valve here that comes close to the interventricular septum. When we compare that to the bottom view, we see that there's not much thickening of the left ventricular walls. That anterior leaf of the mitral valve does not come close to the interventricular septum. The next E stands for equality, specifically looking at the right side of the heart versus the left side of the heart. In this view, the right side of the heart is greatly increased in size compared to the left side, which the left side should always be bigger. The normal adult ratio of right versus left is 0.6 to 1. To increase specificity, we talk about a 1-to-1 ratio as our cutoff. In this view, we can see what is likely a result of increased right-sided pressures that's causing the interventricular septum to bow into the left ventricle. We can see that this is the left ventricle because there is a thickened wall of the left ventricle, which is normal compared to the free wall of the right ventricle. Next is exit, so we're looking at the aortic root. This image is a little bit difficult to interpret because there is a large ascending aortic aneurysm here that's distorting some of the anatomy down here. And so what we're looking at, this is the aortic valves here, and then we can see the aortic aneurysm, the enlargement of that aortic root with the dissection flap. While this is not incredibly sensitive, it's something that is very specific if you see a dissection flap on point of care ultrasound and can greatly expedite someone's care. And the last E stands for entrance, specifically the inferior vena cava. In this view, this is what the liver looks like in a normal orientation. And so we see liver on both sides of the IVC. We see the IVC penetrating the liver, penetrating the diaphragm. This brightness here represents diaphragm, and then draining into the right side of the heart, the right atria here.